These increasing cases, county mask mandates are starting back up today in Williamson, Sumner, and Wilson counties. And now 2 schools in Wilson County are moving to online learning. Fox 17 News' Rachel Dede shows us why the school district says this is necessary to keep people safe.
Wilson County Schools has had a bit of a year. First, 2 of their schools were damaged by the March 3rd tornado, and then COVID-19 came along. Stoner Creek Elementary was one of the schools damaged, and now its students are being impacted by this COVID-19 change.
West Wilson Middle and Stoner Creek Elementary, heavy damage.
2020 has brought several challenges to the Wilson County School District.
For Stoner Creek, and our thoughts are always with them. They were one of the damaged schools in the tornado. Now they find themselves in being transitioned into a remote setting. For the next 2 weeks, students at Stoner Creek Elementary will transition to remote learning. Mount Juliet Elementary in the same boat.
What we've seen is the number of quarantine for students and staff increased dramatically. And with that, the inability to be able to properly staff or even fill with substitutes at that school.
And because of this year's tornado, things get a little complicated. Because of the tornado, students got shifted around a little bit. The tornado damaged both Stoner Creek Elementary and West Wilson Middle School. So Stoner Creek Elementary students are in Mount Juliet Middle School right now, along with Mount Juliet Middle 6th graders and West Wilson 6th graders. However, the 6th graders in Mount Juliet Middle are not a part of this virtual plan. Bart Barker with the school district says this is because of data from contact tracing and how the building is set up.
The data that was from the 6th grade portion of Mount Juliet Middle didn't warrant that at this time.
According to the latest data, there are 31 new student cases in Wilson County schools with 46 students quarantined. For staff, 11 cases with 6 quarantined. But the new numbers are released on Mondays, and so these are expected to go up. Wilson County is in the red zone, according to the White House, when it comes to COVID numbers, and the mask mandate back in place. Barker says that's a good thing.
But it just shows you the level of concern, not only from the school level, but the county level, not only in Wilson, but in surrounding areas as well.
He adds there's a cleaning crew in the schools now, and they're analyzing the situation every day.
The last thing that we want to do is to go to a district-wide remote. And that is saying, okay, we've got to shut the whole thing down and go to remote. We don't want to do that.
Food service is in place for students as usual. So head to fox17.com for details on how to do that.
Metro schools hitting the pause button tonight over plans to continue to phase students back into the classroom. As Fox 17 News' Kathleen Jacob explains, this comes after an emergency school board meeting where several board members expressed concern over the spike in cases across the city.
We keep hearing it. The next couple of months are projected to be a dark time when it comes to COVID-19 and flu season. Now, the majority of the school board is acting on their concerns.
It's a tough decision with no right answer. As COVID cases in Davidson County continue to rise, do you send more kids back to in-person learning?
I think it is the consensus of this board, based on our discussion here, that we are not comfortable moving forward when middle and high schools are much larger than elementary schools. They have much larger classes, much more narrow hallways, and just much more historic exposure to the COVID disease.
I am not in agreement. I want to make sure that I am on record that I do not agree with it.
Some of the issues these members cited: lack of proper PPE and social distancing space, lack of funding for additional staff, and contact tracing, which is primarily done by school nurses.
Our nurses are the initial intakers of that information, and they're tasked with working closely with the school team, identifying students, getting rosters and seating charts, and then connecting that to the indicators by which we would then quarantine a student.
We reached out to the district to try and find out what they're doing to support these nurses, a department already understaffed and facing a tougher job than ever. The district referred us back to this meeting.
We have leveraged a portion of our funds around nurses as well. Contact tracing is significant. It takes a significant amount of time to review rosters, to review schedules, to identify who kind of checks those boxes.
Still, even with that funding, the majority of board members think now is not the time to send more kids back to the classroom.
My personal stance is that we revert back to virtual learning because they're saying, the experts, the scientists saying that the 6 to 8 weeks is going to be the darkest period we ever have.
Having to weigh student health and safety with the possibility of major learning loss.
It should be noted board member Fran Bush was very against this decision and hoped to come to some sort of compromise where we could still have students in classrooms. However, Dr. Battle listened to the majority of the board.
Record. Some wonder if we will ever have a statewide mask mandate. Now, some counties are bringing back the mandates on their own, but as Fox 17 News' Rachel Teedy shows us, some worry that just won't be enough.
So many small businesses are struggling because of COVID-19, but here at Sweet 16th, they hope that a statewide mask mandate could help things open a little sooner. If the governor was standing here right now, what would you say to him?
Hi, Governor Lee. Please put on a mask mandate.
Dan Einstein and his wife Ellen have owned this place for 16 and a half years. They both feel that a statewide mask mandate would be a good idea.
It's thinking of the whole, thinking of your village. And the only way to protect the village is to protect everybody.
For Dan, though, this is especially important. He's a cancer survivor and so has a compromised immune system. And he gets customers that come from counties without mandates, and he worries that makes them more likely to carry the disease.
And we are fortunate. Most of our customers are very thoughtful and very aware. But like you were referring to, the folks from out of state or out of county may or may not have that awareness.
He and his wife have put up social distancing guards to keep people away from the counter. They've closed the seating and have altered employee schedules so they don't work together. And of course, enforcing masks.
We're making sure that everybody has a mask on. That's first and foremost.
I reached out to the governor's team today, asking again about a statewide mask mandate because Dan fears that county by county just isn't enough. I and the Fox 17 News team have asked about this about a half dozen times.
We reached out to his office today.
He is still against the statewide, that sort of mandate coming from the state level.
That's correct.
So I reached out to the governor's team. This comes as cases creep back up. The governor's team told us today he believes Tennesseans should choose to wear a mask whenever they're in public and can't socially distance, regardless of whether there's a local mask mandate or not. He added that nothing is off the table, but believes a local-based approach on mask mandates is the best way to get greater compliance. Some say this is good.
I appreciate the governor giving us the tools to address the issue without forcing a one-size-fits-all statewide order.
But for Dan, he's worried that no mandate means no masks, which means a greater possibility for spread and a bigger danger for people like him.
This is not a political issue. It's been turned into a political issue. If we could depoliticize this, it would be good for everybody.
To see a list of counties that have a mask mandate, those that don't, just head to fox17.com.
In the fight for equality, more than 100 mostly African-American seniors in Nashville are being forced to move because Metro government's getting out of the nursing home business. Fox 17 News' Harriet Wallace tonight to explain what prompted that move and how it's left families feeling lost and frustrated.
For daughter Yakisha Mylan, the only way she can see her mom is through these pictures. Since the pandemic, she says she hasn't been able to visit her mom, who lives at the Bordeaux nursing facility.
It just felt like she's just been neglected, like she has no one to see her, like, I don't know, it's just hard.
What's really hard, she says, learning that the facility is closing in January, and she has no idea if Signature Health, the company that runs the facility now, will find a new home for her, or if she has to do it all on her own.
I kept calling, they told me that they don't know, like they'll give the family further notice where they're going to move the patients.
She didn't get answers. I've got some questions about the closure of the facility, and neither did I. Some family members said that they've been calling, can't get any answers, don't know when their loved ones will be relocated. I wanted to know why they weren't communicating with families who have to make a critical decision about their loved ones, but I didn't get an answer by deadline.
It's confusing, frustrated, it's overwhelmed. It's too much to handle when you can't go in yourself to find out what's going on, to talk to someone instead of over the phone.
But the council's hospital committee is working on a solution. They want Metro General Hospital to take over, at least for a year, to buy more time for families. Councilman Jonathan Hall, who runs the district where the facility is located, says that would in the end cost the city more money. Instead, he's asking for CARES Act money to hold the facility over for the next year.
It was preventable. We could have done better. We can still do better, because this isn't the time in a global pandemic, economic downturn, or in a community that's so disproportionately impacted by COVID to turn out those types of individuals.
The city has roughly about $23 million left in CARES Act money that it's holding on to through December. Councilman Hall says the smartest move, use $5 million of that money and have the city operate the facility in the same way that the sheriff's office took over the jail when CoreCivic ended its contract. There are a lot of moving parts to this, everybody, and a lot of decisions still need to be made. We'll, of course, let you know what happens.